Keeping children safe and healthy in early childhood education and care is the number one priority for the Queensland Early Childhood Regulatory Authority.
Keeping children safe is our first priority. As an approved provider, we need to ensure that all educators are well inducted when they first start to be across any allergies and medical conditions within a service to mitigate any risk that may potentially pose any life-threatening outcomes for children. Training is vital for our educators, so ensuring that the staff all have training in their first aid, CPR, asthma and anaphylactic.
We all have a duty of care, and it's paramount that we make sure that we're providing that for all children that come into our service. And we do this by having good policies and procedures. When we do our induction for any new educators, they do a whole day of induction before they even go into the room with the children, and they're also buddied up with the buddy system to make sure that they are ready to be put into that position.
As an educational leader, I'm moving across the service and working alongside all children, so it's really important that I have a really good, sound understanding of all their medical needs. In each room, we have a medication folder. It visually has a child's photograph, their name and the medical condition. So within that, we also have the child's action plan and risk minimisation plan and any communications between the educators and the parents, so that anyone coming into the room or even just, for us just remind ourselves, we refer to that.
When we enrol the parents into our service, on the enrolment form, there's a medical section that they'll tick yes or no to let us know if there's medical needs. To manage these conditions, we have meetings with the parents. We discuss their needs for their child and how we can have a risk minimisation plan for our families and the child in our service.
So when we're administering medication, we're checking the administration medical record to ensure that it's completely filled out by the families. It'll have clearly labelled the medication and the dosage amount. We're checking the expiry date, the method and how it's taken, the date and time to be administered, and we'll have another educator checking that the dosage, they'll check the date of the medication and that everything is clearly labelled and correct. Some of the strategies that we use to ensure the health and safety of all the children, particularly with allergies, is during meal times, the children will have their own individual place cards and they will be read to indicate, right, that child does have an allergy, and it will specify what allergy that is. So all educators are aware and are able to ensure that that child doesn't come into any contact with those foods or that type of allergy. It is really important that we engage children in learning about medical allergies and medical conditions. So having the signage at their level that they can engage in, something that they are familiar with. So having children in those images as well is really important because they might recognise themselves or a character. It's important that we really understand the children and we look out for signs that, they may not be feeling themselves, something's out of the ordinary. We communicate our observations with our families. If it was a reaction, we have a child illnesses observation form, which we would document that. We would inform the family with a phone call and just make those observations every 15 minutes. If a child's had a medical incident or a severe reaction, we would always call 000.
Managing and supporting children's sometimes varied and complex medical needs ensures every child goes home safely at the end of the day. It's important that educators are well informed and well prepared to avoid a medical emergency.